For our final panel, Nursing Workforce Development, Addressing the Backbone of our Healthcare System, please let us welcome our panelists, Matt Caseman, Dr. Monica Swan, Dr. Juan Biao Mo, and Dr. Whitney Nash.
Hello. Well, they saved the best for last, huh? How about that? All the troopers in the room here, right? Well, for the next 2.5 hours, we will be, I'm just kidding, no. My name is Matt Caseman. I'm the CEO of the Georgia Nurses Association and Georgia Nurses Foundation. We're the state's largest professional nursing association, and I'm fortunate enough to work with some fine, incredible nurses. So, real quick, before we get started, all the nurses in here, please, can you please raise your hand? How many nurses? Woo! Gallup has just polled, according to Gallup polling, you are the #1 most trusted profession 20 years in a row. So give yourselves a round of applause. Today's panel is the Nursing Workforce Development, Addressing the Backbone of our Healthcare System. To put the nursing workforce shortage in context, according to the National Council of State Boards of Nursing, since the pandemic, 100,000 RNs have left the nursing profession, and by 2027, almost 900,000 more RNs are expected to leave the workforce. Georgia is expected to see a 21% shortage of registered nurses by 2035, the second highest estimated shortage among 10 states. According to the March 2022 findings of the American Nurses Foundation Pulse on the Nation's Nurses Survey Series, COVID-19 two-year impact assessment, which surveyed 12,600 nurses, 52% are considering leaving their position, 89% say their organization is currently experiencing a staffing shortage, 66% under the age of 35 reported feeling anxious, and an inability to deliver quality care consistently is now a top reason for intent to leave the nursing profession. Don't need to say it, but Georgia and the rest of the country and the world are facing a nursing shortage, and the pandemic has only made it much worse. It was like pouring fuel on a fire. Not only are we struggling to keep nurses, but there are also difficulties in the nursing education pipeline that we have to deal with. And that is what we're going to focus on today with our esteemed panel. We have Dr. Monica Swan, Dean of the Wellstar College of Health and Professor of Health Promotion, Physical Education at Kennesaw State University. We have Dr. Juan Mo, Dean of the Burdine F. Lewis College of Nursing and Health Professions Professor at the Department of Nutrition at Georgia State University. And we have Dr. Whitney Nash, Dean of Waters College of Health Professions, Georgia Southern University. Okay, all right. Kind of real briefly, to set the stage for today's discussion, according to the American Association of College of Nursing's report on the 2021 and 2022 enrollment and graduations in baccalaureate and graduate programs in nursing, U.S. nursing schools turned away 91,938 qualified applications from baccalaureate and graduate nursing programs in 2021 due to an insufficient number of faculty, clinical sites, classroom space, clinical preceptors, and budget constraints. Most nursing schools responding to the survey pointed to faculty shortages as a top reason for not accepting all qualified applicants into their programs. According to a special survey on vacant faculty positions released by AACN in October 2022, a total of 2,166 full-time faculty vacancies were identified in a survey of 909 nurses schools with baccalaureate and/or graduate programs across the country. Besides the vacancies, schools cited the need to create an additional 128 faculty positions to accommodate student demand. The data showed a national nurse faculty rate of 8.8%. Most of the vacancies were faculty positions requiring or preferring a doctoral degree. A wave of faculty retirements is expected across the U.S. over the next decade. Higher compensation in clinical and private sector settings is luring current and potential nurse educators away from teaching. Master's and doctoral programs in nursing are not producing a large enough pool of potential nurse educators to meet the demand. With all that said, here's where we can begin. Can each of you discuss how the faculty shortage is impacting your school and admissions? And do you have any potential solutions to share? Anyone want to start?
I'm hot, aren't I? It has, at Georgia Southern, it has been a significant problem for us. We actually have open lines. We hired, particularly last year, we've hired every qualified applicant that we can get our hands on. Probably the most significant issue is what we are able to pay, quite frankly. And, you know, any of the nurses sitting out here, I'm a nurse practitioner by training. I hear this all the time. Why would I go into academia when I can make $30,000, $40,000 more a year? It would be a major lifestyle change for me. I would have to really want to do it or work on the weekends and supplement my income, which is, we're in an era where we're really looking at work-life balance, and that is not something that I would really encourage folks to do. So we had a discussion backstage just about, I should also preface this, this is my first year at Georgia Southern, so I'm learning a lot. I'm the newbie here. I'm learning a lot about the USG, the system, and the rules and regulations that go along with that. Also learning about the healthcare and nursing landscape that is unique to Georgia. I came from the University of Louisville in Kentucky, where I was in academics and academic leadership for 15 years. So one of the things, we had the same problem there, and one of the things that we looked at, I was over advanced practice, and we looked at ways to supplement those salaries. And what we were able to roll out was a contractual agreement with outside parties. One example was our health department, who was looking for nurse practitioners. And so we were able to buy out anywhere from 1 to 5 days of their practice time at a higher rate, at the going outside rate. So, $50 an hour. So they could continue, get their practice hours, but also be able to supplement that income. So it was an attractive package that we were able to do. So it's something we talked a little bit about, and I'm learning about, what the ability for us to do something like that would be here in Georgia. I know we have some restrictions in our academic setting that makes it a little bit cumbersome. So that was just one of the thoughts that I had.
All right, I guess I'm going next. But before I start, I just want to say thank you to Health Connect South and thanks to our audience here for sticking with us. Of course, we think this is one of the most important sessions of today, and really also hope that there will be some follow-up, because I know that there's been some tremendous conversations, but I'm not sure the way we can best harness all of that information. And of course, it's a privilege to be up here with Dean Moe and Dean Nash. And so really welcome the kind of conversations, Dean Nash, about some of the creative solutions that you have used in your other institutions. It was really, really eye-opening for me how you navigated that. So in the Wellstar School of Nursing, we have been very, very blessed in many ways just because of our partnership with the Wellstar Health System. Many of you probably know that we're undergoing the doubling of our undergraduate enrollment. We're in year 4 of a 5-year really, really aggressive growth. And I think when we talk about the impact of hiring nurses, it's been primarily the tenure earning lines. And for those of you who are not familiar sort of with the academy, tenure earning lines, of course, are those that will hopefully at some point earn tenure. But they are also not only expected to be nurses and do teaching in that area and do service in that area, but also do scholarship. So what happens when we have a shortage on those lines is that we're not evolving the research in nursing, which is really critically important. But otherwise, we have done incredibly well, I think, with hiring overall, in part because of the generous gifts by Wellstar Health, which means that we could offer competitive salaries. But of course, the issue is still there. Nurses are making more in the practice setting.
Well, good afternoon. Great to be here, and thank you for staying this late to discuss this important topic. I'd like to add a few numbers to what Matt was referring to that you see in the survey. This year, we had 8.8% faculty vacancy rate among all the schools surveyed, which is over 900 schools. I noticed that in the year that 2021, the number actually was 8%. So actually, we have a slight uptick in faculty vacancies. The situation is not getting better. Second, I want to add that Georgia is actually one among the worst states in terms of nursing shortage. We're the 5th lowest in terms of number of nurses versus state population. And third, in that ASN survey, we'll also point out that about 35% of all faculty vacancies are tenure-track positions. And this is an extremely difficult situation among research universities, such as Georgia State. We are one of the 4 research universities in the university system, Georgia. We know that in academia, we have 2 different separate lines. We have tenure-track and versus non-tenure-track. Tenure-track faculty have a higher priority for research, as Monica referred to, and they have different requirements, qualifications. In research university, mostly you have to have a PhD degree to be on the tenure track. And I believe nationwide, only 1% of nurses, around that number, have PhD degrees. And most of the nurses don't get their doctoral degree until mid to late 40s, so their academic career is relatively short. So all these confounding factors have contributed to the faculty shortage. We at Georgia State also have vacancies for tenure-track faculty, and it's extremely difficult to fill these positions.
Great, thank you. In one of my former roles, I was the executive director of our area health education center. And one of our primary responsibilities was to place 3rd and 4th year medical school students in their clinical rotations, find them clinical sites. And we did some work for nursing, but it was primarily medical school students, but it was extremely challenging, not only to find those sites, but to maintain them. And so I can only imagine what the challenges you go through in your institution. So finding clinical sites for students is a challenge. Some nursing schools are entering into partnerships with hospital systems. Can you describe how your institutions are securing the clinical training required for your students? And another part, can you discuss alternative clinical training activities such as simulation, both high fidelity and virtual, that may be supplementing face-to-face clinical? And another part, if you can remember, for those of you using simulation, have you measured any outcomes as it relates to preparedness in the actual clinical setting or performance on the NCLEX exam?
I'll be happy to start. And now, along with faculty shortage, clinical site shortage is another limiting factor for nursing, obviously education and enrollment. In the past, as with everybody else, we've been struggling with that. But we were very fortunate in the last couple of years with a new partnership with Grady Hospital, which is 1 block away from our campus. With that strategic partnership, we were able to increase, at least on our trajectory, to increase our undergraduate nursing enrollment by 67%. So our cohort size will increase from 75 to 125 next year. And as part of that agreement, Grady Hospital is willing to take up to 75% of our senior practicum, and also a lot of clinical rotation in the lower level courses, OB, Med-Surg 1, 2, and et cetera. So that has been a great partnership. And along with that agreement, we were able to get huge support from the Woodrow Foundation, multi-million-dollar support to pay the clinical site instructors at Grady. One of the key factors in clinical site difficulty is traditionally, as a state institution, we do not pay preceptors, and that put us really into a disadvantage in competition with some of the proprietary schools. And as we know, the nursing staff is heavily loaded in hospitals, and so with that partnership, I think we are able to reach 125. But now, what we can do next? The challenge is not going to stop there. And we know the nursing shortage is not going to end in 2 years, and so. I'll come back to the simulation after my colleagues talk about the clinical partnerships. So.
Okay, so we'll add a couple of thoughts here, although you gave us a lot to think about. I'll start with the simulation since we'll come back to that. And our Wellstar School of Nursing has been incredibly well equipped. I think when we moved into our new building, Perelman Hall, about 13 years ago, way before I was there, really equipped with a lot of resources and with the future forward thinking. And so all our clinical courses rely on simulation in some ways, and we have some tremendous resources. But I also want to do a shout out to our leadership team for the Wellstar School of Nursing, Dr. Dias and her team. When it comes to the placement, have just been incredibly proactive. As part of the doubling, in year 5, we'll have over 1,000 students in our program. So you can imagine the kind of leadership team we need to make sure we have all those placements for the students. But we have developed, in particular during Dr. Dias' leadership, really tremendous partnership, obviously with the Wellstar Health System, but also with many other health systems in the metro area and beyond. So our students have really had phenomenal placements. We've had very good luck with that.
And I'll just echo that as far as the Waters College. One of the things that was actually very attractive to the position was when I saw the simulation suite, simulation building actually, that it was from a very generous donor who named our college, and just very impressive. I've been to many different campuses and haven't really seen anything quite like it. The wonderful thing too was it was put in place at just about the right time relative to COVID. So we really, we didn't do, I shouldn't say we, I wasn't there, they didn't do a formalized study to see what the outcomes would be relative to your question about NCLEX, but there definitely is research to support that students do come out with much higher levels of confidence, particularly in their clinical skills. I know some of you nurses sitting here can probably echo this. When I was in nursing school, my OB rotation consisted of me standing on a wall, leaning up and waiting to watch a delivery, one delivery. I think one of the physicians mentioned that earlier in one of the other sessions. With simulation, we are able to run unbelievable cases that very closely mimic what a real delivery would look like, the good, the bad, the ugly, everything. So I think it really is something that took a little time for folks to embrace, just because the high degree of technology that's involved. And, you know, people think, oh, simulation is so much easier. You know, we just throw our students in there. But to do it well really does require highly educated individuals to implement the case studies, help write the case studies, and do the pre-briefing and the debriefing that goes along with it. So I think COVID really did sort of cement the role of simulation in nursing. I think the other question we were talking about was placements, right. We struggle a bit with placements. We have campuses, nursing cohorts in Statesboro and in Savannah, and it is an everyday challenge, absolutely. We have, believe 2 years ago, we were having clinical groups of 8. We bumped that up to be able to get as many students in the hospitals as we can. We try to get as much feedback as we can from our students about kind of what's going on in the hospitals and what types of experiences that they're having. And so we've had to do some work on that, both ends, with our clinical partners and with our student groups. And I think folks here can probably appreciate that. And we are working, we have 2 major systems that we work with, and I've been having ongoing discussions with trying to be as creative as we can to help our health systems understand. They understand the value of the product that we put out, the nursing student, but to understand really what it takes to do that. And in this era of budgetary constraints, it is going to be absolutely critical that we have ongoing relationships with corporate partners. That really, we'll talk a little bit later. I'll have an example of a success story relative to that, but I think that's going to be kind of a non-negotiable going forward.
And if I could add a couple of points about simulation, there are studies have shown that high quality, well-controlled simulation can replace up to 50% of clinical hours without significantly impact the quality of undergraduate nursing education. And so we used quite a few of simulations throughout the course, and obviously more during the COVID years. And I've been told by our nursing faculty, simulation is an essential tool in nursing education. For example, when we discovered the weakness of students in medication dose calculations, and they designed the simulation to give students more opportunity to practice those skills. And as part of that agreement with Grady and a part of the Georgia Foundation gift, we actually also are building a $10 million state-of-the-art simulation facility on campus, and that's slated to be finished by end of this year. So we're very excited about that and see how a bigger role simulations can play in our education. So.
Great, thank you. How can we get more nursing students to practice in the state? Grow our own is a term I've heard many times. Many programs are aimed at getting K through 12 students interested in a health career, especially in nursing. What are some ways we can create or solidify that pipeline into nursing at the high school level or below so they will practice back in their communities, especially in rural areas?
One of the things that's been fairly successful at Georgia Southern has been our dual enrollment program, capturing those students early, getting them interested. I think every school of nursing, has their own idea of creative ways to engage by getting students on campus, summer programming, those kinds of things I think are critical. And I think we all do that, and they're, reasonably successful. I also think a unique idea, because we talk about the need in Georgia of nurses that are placed in rural areas, and that we struggle with that. And I think one of the areas we need to focus on is actually going into those areas and working with those critical access hospitals, helping them identify individuals who are already working there, who have a commitment to that facility, and helping them understand how important a nursing education could be to them. Those are the folks that are going to stay in those areas. The students that come to our campuses and leave the rural areas tend to not go back. And so I think having a real focused plan and embedding ourselves in those communities, I think could be an interesting strategy.
That's a great point.
So I don't have any data on how many of our nursing students stay in the local area, but KSU students in general tend to stay in Cobb County and also in the state. And so we're pretty convinced that they do stay and serve in the area. But, we're also Kennesaw, and so we also serve the rural corridor, especially up north, 75. And we are partnering with several health clinics, and so those clinics, tend to serve marginalized and underserved populations, offering free health care in many cases. And so that has been a phenomenal partnership, not only for our faculty, but also for our students, and obviously for the communities that we serve. And we're really trying to expand those partnerships as well, just because they're so important.
Great.
Well, Georgia State is an urban university, but I'm happy to say that 90% of our students come from in-state, and 95% of nursing graduates stay in the state after graduating and serve the community.
Great.
So they are educated here and serve the local community. as to K-12 pipeline, and we have been fortunate to have worked with Wellstar Health System. If they have the Wellstar folks still hanging around. We've had 2 rounds of summer health fair last year and this year, and then expose them to nursing and health professions. Have high school kids come in the summer, looking around in the lab and see what respiratory therapists do, or physical therapists and nurses, and so has been very exciting. I think that that's another way to engage students early on for the health professions.
Do any of you do the summer health camps with the kids? All you do? Okay.
I'm sorry, I forgot to mention that too. We do extensive outreach too, and we also do those summer programs. They have just been incredibly successful and lots of fun. Of course, we don't have the data yet on what the outcome will be, but really great to instill the sense of learning and also appreciation of health in all its form among these students.
And before we move on to the next question, I just wanted to ask the other panelists, one of the things that we're looking at doing is how to integrate the Certified Nursing Assistant program, whether to integrate it into our program, require it, before entry. Have you all utilized any of those strategies?
Interesting that you should ask. We actually had a conversation about that last week, not for our nursing students per se, but for our nursing interest students who may not be accepted into the program. So on any given day, we have about 2,000 of those students, and many of them opt out and do not stay within our college. And so the Wellstar College, we have 4 academic units. And one of the fastest growing majors is an integrated health science, very flexible major. And so we're thinking about building in sort of micro-credentials, stackable credentials, in order to leverage their interest in health, but also meeting the healthcare workforce needs more broadly. So
We need to have a conversation, because
Would love
that's
to.
exactly what we're doing. We just redesigned our Bachelor's of Health Science, which is to make it a more interdisciplinary approach. And that was one of the thoughts, was to have some of those stackable credentials so that if students don't complete, they still can, enter the workforce.
perfect.
Okay.
Well, we took a step a few years ago in that direction. We established BIS, or Bachelor of Interdisciplinary Studies in Health Sciences, and BIS in Health Informatics. We also have the rehabilitation science concentration in that health science program. And we also have bachelor's degree in nutrition, respiratory therapy, and at the graduate level, we have occupational therapy and physical therapy. And so these students who chose to enroll in one of those undergraduate programs, especially in the major health science program, will be well prepared to pursue these graduate level health professions. Because most of the students come into our college, for example, they declare pre-nursing. Right? Most students, all they know is physician and nurses and health professions. They don't know OT, PT, RT, or other professions. I think that's a way to really broaden their vision about health professions, and has been really successful in contributing to the enrollment growth in our colleges. And I'd like to, since we obviously we're focusing on nursing, but I'd like to bring up everybody's attention to other health professions as well, especially respiratory therapists, for example. There are about 150,000 respiratory therapists nationwide, but according to American Association for Respiratory Care, 92,000 of these RTs about to retire in 2030. That's another dire situation. And the U.S. Bureau of Labor Statistics predicts that between 2019 and 2029, the 10-year span, the job vacancy for respiratory therapists is going to increase by 19%, way above the average profession growth. So, and if we don't train those other health professions in a healthcare setting, I suspect these will join the nursing workforce, join the physician workforce, join the rest of them. And so it has to be a holistic approach when it comes to education pipeline. We have to make sure that every profession is well staffed.
Yeah, in that same vein, I mean, if a student doesn't get into nursing school, I mean, you don't want to lose that student. You'd rather see them go into some area in healthcare at least, and then maybe go to nursing school later. So do y'all have any thoughts on that, or any comments?
We were very blessed over the last, it was about, I think, a month or so ago, to get a generous corporate gift to address the nursing shortage. And that was exactly one of the things that we wanted to look at was we do have students that aren't successful when they apply. And they've spent a lot of time and effort and money. And so we're establishing a program, we have a FTE, that is going to assist those students in helping make decisions about where they want to go in their career. With the hope, and we have found that a lot of students that go into nursing think nursing is the only option. That's really the only thing they know about. And to really help educate them that there are many, many other ways to serve in the healthcare field, and we just simply didn't have the bandwidth with our advising to really have those, conversations. It's not a 10-minute conversation. And so we're going to really look at that. And I think respiratory therapy is one of the areas that we have capacity and it's high need. And so I think that's going to help the student and also help our programming as well.
So Dinesh, really intrigued by your strategies. We're doing something very similar. Would love to have a follow-up conversation. So in our case, we're looking at some really significant curriculum innovation to, again, see how we can streamline those nursing interests who are not accepted into the nursing program, because, again, we have a lot of them. But we have the same barriers that you outlined in terms of advising. It's not an easy shift if you've told your whole family you're going to be a nurse and here you are and you're not accepted. And for those of you outside the academy, it might be hard to appreciate that the nursing program might be the hardest one on campus to get into of all the degrees we offer. Now, we all want, of course, our nurses to be stellar and meet all those academic requirements, but it also means that many of those who want to be nurses will not have the aptitude for that. But there are plenty other workforce options. And so we're trying to work with our healthcare partners. That was one of the things that's been so intriguing here at the Health Connect South, is all the infusion of technology, for example. So is there something that we can do in terms of healthcare workforce readiness at the undergraduate level to interact with AI or robots, or are there new concentrations we should be thinking about? So as I know, as our nursing program, they're revising their essentials, and we're looking at curriculum innovation in our other undergraduate majors. There are all kinds of opportunities. Just want to make sure we have the right people at the table and that we can be very future-oriented, and we're developing concentrations for the next 10, 15 years, not just what we need at this moment. So very exciting times.
And if I could add that even within nursing, there's more than one way to become a nurse. Now, back in 2016, that time Georgia Premier College merged with Georgia State. Now it's become one college of Georgia State University. As part of that merger, their ADN program becomes part of our School of Nursing. And so we're probably the only school in the state of Georgia that has all the nursing degrees from associate degree to bachelor's, master's, DNP, and PhD. And so one way to get to nursing is to become an associate degree nurse first, and then we have the RN to BSN program on our downtown campus. We're also developing the LPN to BSN program a couple of years back, and it responds to some of the demand by healthcare system, and that program is becoming more popular. So there's more than one way to get to become a nurse.
I think that is a really, really important message. Some of my most successful, productive, and outstanding nursing faculty who have PhDs did it what we call the hard way. Have 5 degrees that it took them to get there. But it's just a different path, same goal, but different path.
That's great.
I was just going to say that sometimes those who took the hard way that are more committed nurses.
Georgia is a very diverse state with a diverse patient population. How can the state ensure we have a diverse nursing workforce that is reflective of our diverse state?
I'm happy to start.
Okay.
Well, first of all, Georgia State is a very diverse campus. We are probably educating one of the most diverse student population in the whole country. We actually graduate more African Americans than any other nonprofit university and college in the whole country. Not everybody knows that. 60% of our students are Pell eligible. We have eliminated all achievement gaps based on income, ethnicity, and race. We have become, in the last few years, a national model for student success. And U.S. News just ranked it again us as the #2 most innovative university in the whole country this year. And so in our college, we're also very diverse. We have about 72% of our students are minority, non-white minority. In the School of Nursing, that number is about the same. We also have very diverse faculty body. We actually have about 49% of faculty minority. I think one of the key in growing diversity in student population is have a diverse faculty, because diverse faculty body can serve the role model for the students, and oftentimes the students can feel they're more supported by faculty who look like them and have the same culture and background. And so one of the effort we have put in is to search for diversity in faculty recruitment, and we have put it down earlier in the pipeline, because if you want to diversify faculty, we have to go to graduate students. Those are the people who become faculty down the road. And so we've been working with a number of programs, most notably the Southern Regional Education Board's what's called Doctor Scholar Program, one example. And Florida has a program, the Education Funds, McKnight, Doctor Fellowship Programs, another example. I think we have to start early in terms of the pipeline faculty, so graduate students, faculty, and then student diversity. The other piece I would add will probably try to guide the student into the practice, clinical practice or rotation where they serve diverse population of patients. And I think that in that sense, our partnership with Grady is very encouraging, because you have a very special kind of patient population there, and our students get early exposure to the diversity of the population.
So I'm not going to repeat a lot what Dean Moe said, but we employ many of the same strategies. And you may or may not know, but KSU is also incredibly diverse, perhaps not as much as Georgia State, but we are also known for the diverse student population as well as our faculty and staff. And so in addition to what Dean Moe mentioned that we're also doing in terms of our hiring practices, we are looking for faculty who are supporting the student success, of our students because of who they represent and their backgrounds. Additionally, we have some really very important diversity training as when we hire faculty that is led by our diversity office. And so there are a lot of strategies that are embedded in the infrastructure within our university that make sure that we are very inclusive in all the approaches. And then, of course, as I mentioned, our student placements, equally important that our students get those experiences.
So Georgia Southern, as many of you may or may not know, consolidated with Armstrong State University in, I believe it was 2018. And so two very different campuses. So we are still working through how to really increase the diversity across both campuses. It is a struggle. Our faculty is not as diverse as I would like to see. We do have a diverse student population. And when we had talked about these questions, I did a lot of thinking about this. And, it's the goal should be that our nursing and healthcare workforce should reflect the population in which it serves, or at least be aware of the population in which it serves, right? But we know that in most cases doesn't happen. We also know that, tuition itself is not always necessarily the barrier for a lot of our students. And when I spoke earlier about one of the programs we're going to try to look at as far as helping students who aren't successful move into other programs, that same office is going to look at what I kind of call like the social determinants of success. And so, we know about the social determinants of health and what that means, but things like what is the availability of childcare? And not just, providing childcare on campus, but looking at things like vouchers for childcare. Are we really doing everything we can to understand what our students are going through in their lives outside of the classroom? Living expenses. So we're pretty blessed, and I would say probably across the board, we would agree that a lot of our students get tuition support through, scholarships, federal and state grants, et cetera. But it's the other things that tend to be a burden for many of our students, actually. So the things like childcare, and can they really afford not to work? So our faculty has talked a lot about, looking for, again, outside support in the way of things like stipends and those types of things to really help our, less fortunate students.
That's great. All right, and in closing, what is the most pressing issue that needs to be addressed to enroll more qualified applicants and improve the nursing workforce? I know that's kind of broad, but what are your thoughts?
I think we need to really take a hard look at the whys. I think sometimes when we have a problem, it's very easy just to kind of throw money at it and say, well, we just need to, we all spoke about this, pay our faculty more, open up more slots. Most states across the United States have opened up more slots for nursing schools, which is great. It's great if we can staff those schools. It's also great, it's not a build it and they will come, right? There's a finite number of people who want to be nurses. And so then you have to ask yourself the question, why is there this drop off? And I think, when COVID first started, we saw all the healthcare hero messages. I don't know, people had signs in their yards if they were nurses, and then it really kind of drifted off a bit, if you all recall. Some of our students dropped out of our programs, spread the news around their friend groups about what it was really like working with all your protective gear on for a 12-hour shift. And then I'll bring up workplace violence. It's kind of a hot topic in nursing. And, it is not like it was when I was a bedside nurse, I will tell you. It can be extremely challenging, scary, stressful. There was a Facebook post I saw, some of you may have seen it. It was meant to sort of be funny. And it was a person recollecting a story about what had happened to them as a nurse, what had happened to them in the ER, and getting punched and hit and spit on, et cetera. And they said, if I was a police officer or a firefighter, they would have arrested the person. What happened to me is my manager said, was there anything you could do better? That's very telling. So you have to think about the whys. Are there reasons beyond just pay and your upward mobility? I think it goes a lot beyond that, and I think we need to take a very hard look at that as a healthcare system and as as the academy.
Those are some really, really important points. So I guess I was going to say something different, but let me pivot because you really stirred something up here. Even when I'm reflecting, what we're talking about here today in Health Connect South, it seems to me that, we talk about nurses as being part of a team, but we never talk about nurses as the leaders of those teams. And I think, revisiting that conversation and be just much more intentional about nursing and leadership, right? We didn't see a panel here today about nurse leadership, and I'm not a nurse myself, but I'm a dean of a college with a phenomenal nursing program. So I think we need to have that conversation, and I've heard that expression many times today too about physicians serving or working at top of their license. How about we have a conversation about nurses working on top of their license?
Yes, please, some applause there.
So I think again, workforce, burnout, all those issues, but I think we need to have another larger conversation which might be deeper in terms of how we view nurses and nurse leadership in general.
Absolutely, thank you. You're an honorary nurse.
I think there are logistic issues that we already talked about, faculty shortage, insufficient funds, the state budget, faculty position, preceptors, we have to get funded to pay preceptors, and clinical placements, classroom, lab space, all these are logistic issues. But I think the best answer might be just that what I heard throughout the lunch by Dr. Mandy Cohen when she referred to that story early on in her career when the nurse reminded her to ask what the patient ate. Now, there are two professions that story already touched, nurse and nutrition and dietitian. Those are the health professions that oftentimes overlooked in healthcare. And I think we need everybody to voice that concern and to raise their voice at how important nurses and health professions are.
Great. Well, that concludes today's. Anybody else have anything else they want to share or anything? Okay, all right. Well, that concludes our panel discussion. If you could give the panelists a round of applause here for doing such a great job. And we hope that this has been informative as you do with your valuable work in healthcare, no matter what that may be. And I'd like to thank Health Connect South for this wonderful opportunity and thank all of you all for joining us today. Thank you.